Life is hard. Life is challenging. Life is uncertain. Truisms? Trite? Statements? Maybe so. But how does one navigate uncertainty? Welcome to Talking Psychiatry. In this episode, I will be in conversation with Volker Hitzeroth. Volker is a psychiatrist and a medico-legal consultant for the Medical Protection Society. Volker contributes articles to South African psychiatry on a regular basis, and most recently, in the March 2026 issue of South African Psychiatry, he wrote a piece entitled Navigating Uncertainty. That's the focus of our conversation. Let's join Volker. Volker, good to see you, and thanks for joining me. It's a real privilege to have one of our regular contributors to South African Psychiatry join me.
Well, thank you, Chris, and it's lovely to be here. Thank you for the opportunity, and all the best for this new adventure of yours.
Well, we'll see where it goes. I mean, obviously, talk about navigating uncertainty, which is the theme of our discussion today. There's never anything that's certain. All one can know is what's immediately in front of me, and that happens to be you on this occasion. But I got to ask you off the bat, you're a psychiatrist. You're now a medico-legal consultant for the Medical Protection Society. So just a little bit of background in terms of your transition from psychiatrist, which you still are, obviously, but to medico-legal consultant, and a little bit about the Medical Protection Society, because obviously there will be viewers who are not medical folk. There may even be viewers who are medical who are not members, and that would be a mistake. But I'm not here to promote MPS. Just, your transition from psychiatrist to MPS and what that was all about.
Well, thank you. Yes, absolutely. Chris, I had 15 years of clinical psychiatry after I graduated at Stellenbosch. And over the last sort of 5 or 10 years of those, I was quite interested in the ethics, the medico-legal aspects, maybe some of the deeper, bigger questions that arose in psychiatric practice. Now, compared to all the other specialities, psychiatry deals with some really deeper issues, I think. And I found that quite interesting, at times a bit scary. I probably also have to admit that I was probably a somewhat anxious psychiatrist. I was always worried about the law. I always wanted to do what was right and what was good and what would help and keep me out of trouble. So I regularly referred questions and queries to the MPS.
Okay.
As an advice, I asked advice regularly from the senior colleagues at the MPS, and I found it very helpful. Now, the MPS is a large organization, international organization that supports, advises, and protects doctors across the world. You might not know, but we've got about 30,000 members in South Africa, healthcare practitioners.
Wow. Okay.
And
that's a lot.
We provide them with medico-legal advice and support and protection. And
fantastic.
As I developed my interests, I did a degree in medical law and ethics, which was very stimulating. I mean, that really sort of boosted my motivation. And then a job became available at the MPS in the UK, and I applied, and here I am, and I've been doing this now for 11 years, and I thoroughly enjoy it. I think it's a niche job, and I really enjoy it because it creates opportunities for me to really help doctors who might be having the worst day of their life.
Well, let me tell you, there's nothing worse when you get that complaint and you're kind of all at sea because the question is, how do I deal with this? How do I move forward? And I think the MPS in that sense, certainly I've had experience of MPS directly and they've been exceptionally helpful. But I think what's interesting, as an aside, I did an MSc in bioethics and health law. So I can relate to your interest. And I think that psychiatry, much more than the DSM-5 approach, to diagnosis and psychopharmacology and all the rest of it, which is all very important. There's a lot more that goes into the decision-making of a psychiatrist on a daily basis, which they may themselves not even be necessarily fully aware of. But it's a discipline that really pulls in a lot of different elements, not least of which the ethical, the moral. And so we confront those on a daily basis with actually probably each one of our patients in terms of all of the decisions we make. But I think the one thing that I have to say is that your articles that you write for South African Psychiatry have a very human feel to them, which I really appreciate because it kind of moves beyond the, as I said, diagnostic and the sort of management. It kind of speaks to something much more. And I mean, just looking at too, the healing power of gratitude and holding on to hope were just two of the previous articles that you've written. And, holding on to hope is very important in terms of working with our patients, often working with patients with chronic
Yeah.
conditions
Yeah.
where, there may be a sense of hopelessness and what kind of life am I going to have and how's it going to be for me in the future. So I think your articles really speak to the humanness of the discipline of psychiatry, but also as medical practitioners generally.
Absolutely. Well, I hope they do, and that is part of my intention. The work that I do and that I did as a psychiatrist and now as a medical legal consultant really highlights the uncertainty. It highlights the worry. It highlights the fear that we all have, as practitioners across South Africa, but also in the bigger world around us.
Yes.
Our lives are infused with uncertainty, worry, and fear. And currently, that's what I see. When I deal with my work, I see people who are anxious, who don't know, who are worried, who are uncertain on what to do. So it sort of blends it all together into my current job.
Well, I think that, navigating uncertainty, life is uncertain. One may think it's a little bit trite, and I kind of go back to Benjamin Franklin, and I think he said nothing is certain except death and taxes. But the truth of the matter is you still have to navigate it. You still have to deal with it. And I wanted to get your take on uncertainty because something struck me that we live in a time of social media. We live in a time of constant availability of lots of information, knowing what to select and what really works or doesn't work for us, but it's a constant bombardment. And it's almost as if the more information we have, the more uncertain we
Yeah.
become. You would think that the more information we have, the more certain you become because you've got information. And I kind of think that there's almost a paradoxical relationship whereby the more information you have, the more uncertain you become because it's just a constant barrage of, and let's face it, generally bad news and provocative commentary.
Indeed, indeed. I mean, you could even argue that there's an overload of information. And given the current climate, one struggles to probably prioritize information and choices and decisions to come up with maybe a reasonable way forward. It is so swamped with various opinions and influences and news bulletins, much of it not even that accurate. And that just adds to the whole uncertainty dimension.
I think that, we're not really getting there yet, but we kind of are there. This issue of discernment, because I think that, as we're getting into the conversation, it strikes me that one has to be very discerning in terms of the information that you allow in. You've got to have this filter where you arrive at, I suppose, sources of information that you feel are credible because you've researched it, and you narrow your focus down without becoming narrow, because I think it's always important to get a range of opinion to fully inform yourself. But I think this notion of discernment is a very important component of actually navigating uncertainty, because you start to filter out a lot of what unsettles you. Don't know what your thoughts are there.
Yes, absolutely. But Chris, to do that, or to be able to do that, one also needs to be quite secure within oneself. You kind of have to be able to have the knowledge and the confidence to be able to say, well, this actually I'm going to not look at, or this is not adding to my improvement, or this isn't
Yes.
helping me right now. And I wonder sometimes whether these days people struggle with that. They're exposed to everything and all the time, constant information, influences, opinions, when I agree with you, I would think one needs maybe 1, 2, 3, 4, 5 mainstream sources and be comfortable with that, and then realize, well, actually, this social media post or this influencer maybe not really for me. I'd rather deal with
Yes.
something else constructive in my life than doom scroll a little bit longer.
Well, the doom scrolling, I mean, that's a problem. I mean, Instagram, I've got a younger brother and he often sends me Instagram clips. And before I know it, I'm looking at all these AI generated scenes of cats doing crazy things because I happen to like cats. And then it very quickly picks up and I'm just bombarded. And I think, no, hang on a sec. 30 minutes later, this is no good. And to be honest with you, you got to make a decision and say, you know what, I'm just not doing that. So, cats are kind of benign in that sense, unless you're a mouse. But cats are generally benign sort of occupation or preoccupation to follow in that sense. But the news is really pernicious, and I think at times it's part of what drives a lot of uncertainty and a lot of anxiety. Because as you say in your piece, uncertainty drives anxiety. And you also talk about some people who are very distressed, those who are not distressed. And I think that it needs to be somewhere in between. You probably need just a little bit of anxiety. You can't be completely without anxiety or overwhelmed by anxiety. I think a little bit of anxiety is not a bad thing.
Well, look, a little bit of push, a little bit of anxiety, a little bit of stress, of course, increases performance up to a level. We all know
Yes.
about the performance curve, that a little bit of stress and anxiety and drive increases performance, but then you get to the peak performance, and after that, further anxiety, uncertainty, worry, and stress reduces performance.
Okay, so a little bit of anxiety is a good thing. And I would always say to my patients, you cannot be, and for example, in terms of medication for anxiety, you don't want to remove anxiety because I think anxiety is also your alert where it says to you, maybe this situation is not so good. And you don't want to switch that off, but you don't want it to be overwhelming you, obviously. So I think it's the same with uncertainty. A little bit of uncertainty is not necessarily a bad thing. I mean, do we have to eliminate uncertainty completely to live comfortable lives?
Well, I don't particularly think so. I like a bit of uncertainty, but that comes from maybe a somewhat philosophical point of view, because if I am uncertain, then I start thinking and questioning and challenging and reflecting. And
Yes.
I personally like that process. I I I I'm very comfortable thinking, reflecting, um, and weighing up scenarios. I think we should all do it. I think it's a good thing. I mean, I think we should all do more of that, more reflecting, more thinking, more pausing, and weighing up difficulties.
So in other words, you're almost saying uncertainty might provoke a bit of curiosity, and a bit of curiosity will lead to exploration. And that is not a bad thing. That is a good thing because you are busy broadening your horizons and you're acquiring new information. So I think that, and it's a word that I had kind of come to as I was reading your piece, which is the issue of reframing. And I suppose as opposed to looking at uncertainty as something which is threatening, one is looking at it from a more curious perspective in terms of what you're describing.
Absolutely. I mean, wouldn't it be a better place if everybody just paused a little bit and just thought
Yes.
and just held the uncertainty in the palm of their hands? If they could actually just think, pause, breathe, and then reflect and then come up with an answer instead of reacting.
Well, I think that you touch on something very important, which is this whole distinction between reacting and responding. Reacting is something which is much more instinctive and immediate, which is sometimes necessary. Whereas responding is much more thoughtful and considered. But that requires a certain level of maturity, experience. And I don't want to say that because you're younger, that's not possible. But the truth of the matter is, I do think it requires a measure of self-awareness where you say, now, hang on a sec. This is troubling me. What am I going to do here?
Yep, yep, absolutely. And I think if we look at the world around us these days, that is lacking. Everywhere you look, everywhere you hear, there's reaction, there's aggression, there's instantaneous responses. There is a lack of thoughtfulness, there's a lack of consideration, there's a lack of kindness. And I think
Ah,
looking for that.
kindness, very important. Sorry,
Yeah.
carry on. I interrupted you there because I picked up on the word kindness.
Yeah, we're all looking for the same thing, Chris, aren't we? Everybody wants to do the basics in life, wants to do well, wants to look after themselves and their family, wants to get along with people. We're all part of the human race together. We all have our
Yes,
differences as well, which is wonderful and great. Our diversity is wonderful in South Africa, but
yes,
also in the world.
yes,
But it takes a little bit of a mindset shift to recognize that we are one of a number of people on this planet, part of a greater humanity, a global humanity, and we all want the same thing. And if we react and if we shoot from the hip, well, then it's not going to go well. Well, I would advocate for a little bit more of a pause, a thinking, a reflecting, managing uncertainty safely. It's okay to be uncertain. We're all uncertain.
yes.
Often, it's part of being who we are. We've just got to
Well,
manage it.
I think it is part of the human condition, and we'll sort of probably close with that, piece of wisdom. I always remember George Hart, former academic head of department at Wits and a mentor and friend to me. And I remember him saying once that when he had to deal with an issue, often he would write a letter, but he wouldn't send it. Because in those days we wrote letters. I think it was before email and the ability to just get on your keyboard and fire off a response. He would write a letter, he would let it, like coffee, just kind of filter and brew. And then the next day he would come back to it, read it, probably throw it away and write another one. And I think that's the whole point, is that there's a certain immediacy to contemporary life, which I think is part of the problem, actually. And I think I'm not on X, formerly Twitter, but I often hear of how people get into these hugely contentious debates and everybody's just firing off comments. And to me, it feels as if everybody is just reacting. Nobody's really pausing, thinking, stepping back and considering what they really want to say, if they want to say anything, because
Anything.
sometimes
Yep.
silence, the old silence is golden. Well,
Yeah.
sometimes it is.
Yeah, absolutely. And that's why maybe one could just actually pause, just be silent and just
Yes.
reflect or just breathe and just hold the uncertainty. Sometimes doing nothing is actually also all right. And things resolve.
I think that that's a conscious decision. And that is why it almost feels paradoxical, where I would say to people, doing nothing as a conscious decision is doing something.
Yeah. Yeah. Yeah.
It's not nothing, actually, because you consciously make that decision. And of course, you mentioned the word silence. How do we find silence in a very noisy world, which is, we are constantly bombarded with noise. There's this signal versus noise. What's the signal versus what is the noise? And again, it comes back to that issue of filtering, but filtering consciously, because you're aware of the fact that you're being bombarded with noise constantly. Everybody's clamoring for your attention.
Yep. Yeah. Attention these days is worth a lot. Look at all the companies, look at all the tech businesses. They're all clamoring for our attention because attention earns them money. We've
Clicks.
been struggling with uncertainty for forever. The human race has been struggling with
Yes.
uncertainty for forever and ever. This isn't new to us. It's just that the environment has changed. But for millennia, people have struggled with uncertainty. So we should actually be better at it, I think.
You'd think so, but I'm not sure that we necessarily have become better, because I think that we live in a world where there are so many immediate solutions to problems. And I think to some extent we've almost come to expect that if there's a problem, we can fix it immediately. There's this inability to delay gratification. And I think there's that old study where they took the kids who were 6 years old and they tested their ability to delay gratification. They had a very specific experiment. And then 30 years later, they went to find out, well, what happened to these children? And those who were better able to delay gratification already at a young age functioned much more successfully in the world. So the ability to delay gratification and the need for instant solutions, I think, is also part of the problem, where we've lost sight of the fact that exactly what you're saying, uncertainty is part of the human condition.
And I think, Chris, if we wanted the better answers, if we wanted good answers to life's problems, either personally or even globally, if we wanted to find the good answers, we won't find them with instant reactions. We'll have to reflect on things. We'll have to
Yes.
sit down, think, and just hold the uncertainty for a while before we come up with a considered or a more considered solution. I think we'll make better decisions. We'd make good choices, which we all want, if we just
Obviously.
pause.
So now, as you're talking, I'm suddenly thinking artificial intelligence, AI, the speed with which AI is able to arrive at solutions. How do you think that's going to impact, and what do you think that is doing? Because coming back to the issue of humanity, there's another aspect to this, which is the transhumanist movement and transhumanism, which is something I've become a little bit interested in. But just to touch on AI, how do you think that's going to impact on exactly what we're talking about? Because that's providing you with, I mean, this is unbelievable speed, not necessarily accuracy, but unbelievable speed of providing you with kind of pat solutions.
Yeah, look, I do think AI will change the way we do things. Absolutely. I mean, we see it already in our level in the medicine and in medico-legal sphere. So I think it
Yeah.
will have an impact. But I think once the initial wave is broken, Chris, then ultimately, again, I think we'll have to use AI, and it will be useful. It truly will. It will change the way we look at things. But we will still have to go down to the basics of what do we want, what is important to us, what will make us human, what will keep us human. Now, I know that people will say AI will take over and they'll develop sentience. Fair enough, it might or it might not. But I do think that despite all the modern electronics, technology, computers, AI, deep inside, we are wired for a few basics, and that is to care and be cared for, to be connected with people, to be kind to each other, to help each other. You know, I'll often find myself coming back to those real bottom foundational values or characteristics. The rest I find is important, and we all have to make do with it, and we all have to be good at it. But when you're really thinking about yourself or your loved ones or where you fit in the world, we come back to things like managing uncertainty, hope,
Yes.
gratitude, resilience, caring, connecting, all those deeper values.
And I think that's correct. They are deeper values, and they're not just words. And I think we need to make sense of them, in terms of what they really mean. But as you were talking, I was thinking, is it possible that AI will force us to rethink what it means to be human and actually invigorate the humanness that is within us and bring it more to the fore?
Well, now that you say it, I mean, I haven't really thought this through, but I could imagine it would. Or, well, let's ask the question, why not? Because maybe with all this AI stuff happening, it might reinvigorate human or being human through these deeper processes where we realize, but wait a minute, AI is good and it's important, but it's not full of hope. It's not full of care. It's not full of compassion. It's not full of gratitude. Again, I'm coming back to those core values that I quite like. And I think those are the core values that connect us, Chris. Those are the core values that connect us across continents, across cultures. They really are fundamental to who we are and where we come from. If you think back thousands of years, those are
Yes.
the things that have kept us going and that have connected us and that have made us successful.
Absolutely. I mean, communities. So I'm going to come to that, but there was something that it struck me that if we embrace uncertainty, I think one of the issues for me is that when you're faced with something uncertain, sometimes it's not a bad thing just to do a check-in on what you've got that is certain. and to reconnect with things that are actually important to you, just to give you a sense that you actually have a solid foundation with which you are now able to engage with uncertainty from a different basis, from a stronger basis. So I think in a sense to embrace uncertainty, but almost immediately to say, but let me think about what I've got in my life that is certain, that is good, that is solid. And I'm thinking about that as a technique. I don't know what your thoughts are on that.
Well, as you mention it, you mentioned that the solidity, or something that is solid, something that we do have, the certainty that we do have. And I think that's helpful. The sad part about our current world is that a lot of those initial, or those deeper anchors, the deeper certainties are struggling, and I think in my article I mentioned the things that have given us certainty before, a lifetime job, or for that matter, our
Yes,
churches, or our faith, or our families. They
yes,
are slowly being eroded away, I suspect, or in some instances, or in many instances, there's divorces, careers aren't the way that
yes,
my folks and your folks had careers. Uh,
absolutely.
Faith is struggling, or traditional faith is struggling. So these
Do you think that
anchors of
is,
certainty are maybe struggling, and it's difficult to find them and hold on to them. And then we
do you
become a
think
little
this
bit
is a, do you
rudderless.
think this is a, do you think this is a function more of Western culture?
Well, it is definitely a symptom of Western culture. If I think of maybe other cultures where they have less of this that we're speaking
Yes.
about. I mean,
Yeah.
Eastern cultures, African cultures, much
Yep.
more community based, and those ties within a community are very, very strong, and they add a huge foundation and strength and commitment to each other. So I suppose it could very well be that it is a symptom of where we are in our modern Western way of life.
Well, I suppose where I'm going, there was a very good article, and the phrase deaths of despair was in the title. And it was looking at mortality rates in the United States of America relative to European countries. And all of the things you mentioned, family, community, faith, how these things have changed, been eroded over time within our culture. And, people often speak about the mental health crisis. And I started to think about, and I'm not saying I'm right, but it kind of struck me, to what extent societal change, um, almost in the name of progress, but societal change has contributed to this distress. And what we're seeing is not so much disease or illness, but more distress in terms of the mental health crisis. I don't know, and I'm just throwing it out there. And viewers might be watching this and thinking, "What the hell is he talking about?" But if it provokes you to think, that's a good thing. So now I'm putting that to you, Volker, to
Well,
to hear your
as you
thoughts.
as you were talking, Chris, I was now also thinking, and I recall this from previous conversations and books and articles. Long ago, the adults in the room also said that society is changing and the youth is we're
Yes,
losing the youth, and that everybody was cursing the previous generations, and worried about where they were going and how society was falling apart.
yes,
And one could now argue contrary to what you're saying, which is, well, we've been here before, and we all go around in a circle, and every society goes through these cycles of believing that things are falling apart, when maybe they do, maybe they don't. But there's always something new that sort of regenerates. I mean, I don't know. We'll have to live over many, many cycles to see, hey, now, won't we?
Well, I suppose we're in it. And so I think when you're in it, you don't have the luxury of knowing. Again, it's about uncertainty, actually, because we don't know where this is going. I suppose things do swing. The pendulum does swing. And I think that there is probably an inherent need for equilibrium and a homeostasis. And I think about it in terms of our own bodies, heart rate, respiratory rate, glomerular filtration rate. Our bodies are constantly calibrating what the needs are and moving towards an equilibrium and a homeostasis. And maybe society will do the same thing. A lot of the things that maybe we think are outdated and outmoded and we want to move away from, we might actually move back towards maybe, tradition. I'm talking about tradition. And the one thing I do notice in psychiatry, we've always had the biopsychosocial model, and then spirituality started to move into it as we became cognizant of the fact that there are needs. And everywhere I look, and people I'm listening to, and podcasts I'm listening to, and things I'm reading, I'm getting the sense of an emerging rise in the need and awareness of a need for a more spiritual basis to our existence. I'm not sure if that's been your experience or what your thoughts are.
Well, mention the word our needs, and I'm going to link up with where we were earlier in this conversation,
Yes,
which is, our needs are probably right there, our very basic foundational needs, which is to connect, to care, to share, to have compassion, and to be kind, and to be grateful. I think a lot of those factors, those needs, those values don't really change. Their manifestation might change. Long ago they didn't have a cell phone to connect. Well, these days we do, but the need for connection is still there. Or
yes,
being resilient is still there. But long ago you had to be resilient maybe for the cold and the hunger and the wild animals, while these days you have to be resilient for other things. So I
yes.
often see it that I see it in a way where these human factors are still there, these human needs, these wants, these desires. They're all right there on a foundational level. But up here, it changes constantly. There's constant flux. The world changes. What is around us changes. The manifestation of these things and the world around us changes at at a more superficial level, while at a deeper, fundamental human level, these things don't change much, because I think they've been built up over many, many, many years of our evolution and our societies and our social interactions.
Millennia. But I suppose in a strange way, not strange way, but one might look at social media in that context, because there's a lot of communication going on. So clearly people have a need to communicate. The question is how and in what context. And I think that maybe that is what needs to shift a little bit. So the whole issue of connecting, not just with friends and family, but communities, and being connected to a bigger whole. I had an earlier thought, which I kind of slipped, but I just want to bring it back in. This whole issue of peace. I think you might have mentioned peace. I'm not sure that you did. But I was thinking that, peace in the world begins with peace in the individual. And this whole issue of just finding that inner peace, which I'm connecting to spirituality and how we deal with uncertainty. Because if one person, if they are at peace, they tend to transmit peace. And I think that, as opposed to always looking beyond for peace, I think we need to look in ourselves and say, are we at peace? Because if we are, maybe it transmits, and so it starts. I'm, speaking very
Well,
philosophically here and
and
very
that's
optimistically.
lovely. And I mean, if one pauses and just reflects a bit, well, then you become peaceful, or a little bit more peaceful inside yourself. Then things start making a little bit more sense. You might not have the answer, you might not have the solution to the bigger problem, or to the distress, or to the uncertainty, but immediately there's a calming down, there's a settling down, there's a taking a breath and just being aware rather than having to do. And I think that's helpful. And I mean, I do think it would help for peace, but it would help for a lot of other things too.
Absolutely. Now, you spoke in your article about mastery, and maybe to some extent we've covered that. But is there anything more specific that you wanted to say? Because I think that you had a sense that maybe in navigating uncertainty, we haven't necessarily, or the capacity to navigate uncertainty. There's a mastering that needs to take place, a need for mastery. So maybe you want to elaborate a little bit on that.
Thanks, Chris. Yeah, what I've found when I read up on this topic, and I've read a lot because it obviously interests me, is that we have to not just be aware of the uncertainty, but we actually have to accept it. Uh, the immediate emotional primitive response is maybe one of rejecting, of fear, of wanting to resolve. When contemporary articles and contemporary thinking is actually more about we have to accept this. Uncertainty is there. It's part of life. It's part of living. It's part of the world. And if we don't even accept that, well, then we really are going to struggle with this whole uncertainty in the world. So if we could at least just understand that uncertainty is part of life.
Yes.
It doesn't mean that we've done something wrong. It doesn't mean that we're sick or that we're bad or that we are guilty of anything. It just is. And if we
Yes.
can at
So I
least
think
accept that, well, then we've already gone very far, really.
so I think that the word that comes to mind is acceptance. So I think if we can accept uncertainty as part and parcel, we are less fearful of it, more engaging, or we have a greater ability to engage with that which is just part and parcel of life. So I think mastery maybe begins with acceptance.
Well, if we, well, I would say so, but let's make it bigger again. Let's pull it out
Yes.
from a bigger perspective, because there are different ways of responding to uncertainty and fear and worry and stress. I mean, one way would be potentially to accept that uncertainty and worry and stress and anxiety is a bad thing. And we must try and avoid it. We must do as much as we can to avoid it. So we treat it, we therapize it, we throw pills at it, all within
Yes.
reason at some stage and in the right context, perfectly reasonable. But it is one
Sure.
way of looking at this, is to say that uncertainty is a bad thing. Of course, you could have the opposite, which is, well, maybe uncertainty is actually a good thing. You know, fear, worry, uncertainty, stress is actually a good thing. We need to not just make it go away. We might need to actually just face it. We have to strengthen
Yes.
ourselves, because we could grow with that process, you know, by dealing with pain and suffering and uncertainty. We're actually growing as people. We are growing as persons. We become richer. Of course, you could have a counter argument, but again, within the right context, it might not be such a bad position to hold. And then the third option is where we started off now, which is accepting. We just accept it. It is just there. It's valueless. It doesn't mean it's good or bad. It just
Yes.
is. It exists. And what we decide is good and bad is what comes from us, and we impose it onto a neutral thing called uncertainty. And if we say it is bad, well, then we get all negative and bad and bad. While if we say it's good, well, then it's all good and wonderful. When actually it's a neutral thing, we impose our own prejudices onto it.
And I think it's very difficult to see the wisdom that somebody else will share with you, as in, this experience will help you to grow. And you need to go through this in order to come to a different understanding of life, of yourself, and that ultimately it will be to your benefit. And you're thinking, give me a break. I'm suffering here. I'm really struggling. And you're telling me, it's all good. You'll see down the line, you'll look back and say, wow, that was a period of growth. But in actual fact, you could probably look back from any situation that you find yourself in. And if you care to look at your life more analytically and more carefully, you will probably find that there were periods of struggle, periods of uncertainty, and periods of growth that made you wiser, actually, and brought you to where you are, which doesn't mean that there will never be uncertainty again, because as we've established, it's the reality of life. But I think it's often very difficult in the moment to kind of take that advice that it will pass and you'll be better for it.
Well, and one must be careful about imposing your own view, maybe as a doctor now, as a psychiatrist, onto
Sure.
others and your
Okay.
patients or your family. You know, those are insights that individuals have to come up themselves. They have to make
Yes.
those decisions, and I think we'll get to those sort of insights if we just pause a little bit and just think. Me as an individual, I mean, I don't need somebody telling
Yes.
me I must suffer because they think I'll be a better person for it afterwards. But
No, exactly. You're
you
busy
know,
saying, hey,
but if I just sit and think a while, and if I just reflect a while, I might get to that conclusion depending on my certain circumstances, my personal circumstances. And then I've got something I can work with as an individual. I might get to the opposite view, which is, in this particular case, no, wait, this I'm not going to grow here. This is just breaking me down. Well, fair
yes,
enough. But I'll only get to those conclusions once I've had a deep think, once I've reflected holistically on a situation, and I've not just reacted.
Well, I suppose what it requires is that one holds a person that you might be working with through an experience. And once you get through the experience, you reflect on how they actually engaged with it and how they actually overcame and have come out the other side. But you've held them through it, as opposed to saying, no, you've got to go through this. It'll be good for you. That's not what they want to hear, but it's what you understand. But there's a way of actually engaging, so you hold the person. But I wanted to come to medical practitioners, because I think that for us as medical practitioners, uncertainty is part of the game, but yet there's always an expectation on the part of our patients that we will provide certainty. And I think that's quite stressful, actually, for the medical practitioner and for the patient. And you allude to that, actually, or you mentioned that in your article, that for medical practitioners, we have uncertainty diagnostic management. But of course, on the other side is the patient who's sitting with that uncertainty, and we might get too caught up in ourselves and almost forget their uncertainty, and they're looking to us for certainty. So that's a very interesting dynamic. Your thoughts?
Yeah, and I agree with that. I think that as doctors, we really do have to manage uncertainty. I mean, of all the professions that I can think of, being
Yes.
a healthcare practitioner is probably right up there with having to manage uncertainty. Of course, that is within the clinical context. Uh,
Yes.
you know, and without knowing, I think doctors probably are very good at managing uncertainty. If you ask them, they'll probably say no. But if you look at what they do every day in a consultation room, you'll probably find that they are constantly weighing up and managing uncertainty within the clinical context.
Sure, absolutely.
And now, I also actually think that of all the specialties, psychiatry is the one that manages the uncertainty the best. But then I'm allowed to say that. If I
No, I
compare,
would
if
I
I
would tend to agree with you
Yeah. Well, if I compare it
as a
to other
psychiatrist.
specialties, I don't want to say that they cannot. But I mean, if you just think back to our clinical life, or if I think back to my clinical life, you know, I and we as psychiatrists really do have to manage serious uncertainty and risks and different aspects that all collate in one decision. And often, unlike maybe a more surgical discipline, you won't know what the right answer is, ever. In surgery, you'll get a biopsy and then you'll know what the right answer is. And it is as black and white as a report on a paper by a pathologist. In psychiatry, you won't. And you might not know that answer for weeks.
Months,
And yes, and you'll
years.
have to manage that.
Yeah, yeah.
You'll have to go home that afternoon and manage that uncertainty. And I think, coming back to where we started this part of our conversation, I think doctors and psychiatrists are probably really good at managing this, despite maybe not appreciating that skill. Um,
Well, I think that's part of the art of psychiatry, is how you engage with your patient around your own uncertainty sometimes. It's not that you're saying, I don't know what the hell's going on, because that's not very helpful. But I think it's a process of exploration as to what the best approach might be given the circumstances. So I think that very often the uncertainty is couched in a more exploratory journey that you undertake with the patient. And I think that's got a lot to do with the doctor-patient, therapist-patient
yes,
relationship, which is so important. And I think it builds trust, because I think patients appreciate the fact that you're working together
yes.
to find a unique solution for them.
Yes. And as you were speaking now, the word ally came in, because a psychiatrist's best ally is their patient.
Absolutely.
If one can manage this all within a deep therapeutic relationship, well, then you've got a really good rapport, and then you can manage uncertainty a little bit easier. It might not go away, but you've got a way forward that you can hold that uncertainty alongside your patient and walk the
Yes.
walk.
Well, I think it's a partnership, and I think that I kind of understood as the years passed, this
Yeah.
sort of hierarchical approach is kind of shifting, which doesn't diminish the role of the psychiatrist, and it doesn't necessarily elevate the patient above the psychiatrist. It just brings you together, and you form something that is much more cohesive and much more valuable, I think, where you work collaboratively as best you can under those circumstances. But I wanted to shift gear a little bit to something you mentioned, which is the issue of philosophical approaches to uncertainty. Now we get a little bit philosophical, and you mentioned the issue of restrained pleasure. And I kind of looked at that and I thought, we live in a world of immediacy. We live in a world of instant solutions, instant gratification, food delivered to your door, stuff delivered on your laptop or your phone. So this concept of restrained pleasure is a very interesting one in contemporary society. I'm going to hand it over to you to explain, elaborate, and motivate.
Well, let me put it out there. I'm not a philosopher, and I don't have a degree in philosophy. So this is maybe an amateur way of looking at things. But you're quite right. Look, our world is filled with immediacy and immediate gratification. And you mentioned that study of the kids, and I think it was the delayed gratification study.
Yes.
Now, yeah, look, philosophers have wrestled with this forever and ever, and I think you might be alluding to the Stoics, Stoicism.
Yeah. Oh, let me just Marcus Aurelius.
Yes, I've also
good
got
reading.
He was
good reading.
Stoic.
I mean, he was a Stoic, and I must say, I'm just gonna quote: "In the morning when thou risest unwillingly, let this thought be present: I'm rising to the work of a human being." Speaking of the humanness. And I mean, he wrote about that. And I mean, it's like, wow, okay, this is now.
Yeah. So what this illustrates is that, humanity has been struggling with this for millennia, and I mean, Marcus Aurelius was, I think, the Roman emperor at one stage.
Correct.
The philosopher
He certainly was.
Like that.
And this was written as a diary. This was not written for other people as some kind of philosophical treatise. It was written as a diary for himself, actually. He was talking to himself here, which then got converted into diaries. And what's interesting is I do see an increasing interest in the Stoics and Stoicism. I mean, there's another quote. I read the whole book, but I mean, there's two quotes. And what he says is, I affirm that tranquility is nothing else than the good ordering of the mind. And I thought, okay, wow, that because we spoke about peace earlier and tranquility and the ability to kind of step back and think about things. And there's Marcus Aurelius. Yep. He's saying, well, a well-ordered mind is the source of tranquility.
Well,
speaking about philosophical approaches.
Yes. And I mean, that is the Stoics is just one approach.
Absolutely.
There are so many different approaches and different thoughts on all these fundamental human values and characteristics that we've mentioned before. They've all thought about it. They've all written about it. They've all philosophized about it. They've all shared it. I mean, the Stoics are, if I recall vaguely, know what you can change or know what you can change and know what you can't change. Make peace with the things that you can change. There's so much wisdom in just that philosophy, while there are now half a dozen others, the humanists and the utilitarianisms and the existentialists and the deontologists. I mean, isn't it interesting? Isn't it fascinating? Imagine being able to delve deeper into all of these thoughts, patterns, these traditions, and wrestle with life's problems. Ultimately,
and
it comes down to just think and make peace with things.
Also, to give yourself time to think. I remember when I was appointed to a headship, somebody said to me, make time in your diary for you. Make time to think. You can't just constantly be moving from one thing to the next, to the next, to the next. Make time to think. And I think that was so important. It wasn't that I was making time to do nothing, but thinking is not doing nothing. Thinking is doing something. Coming back to that discussion around what is something, and that thinking, I think is so important. But as you're talking, and there are all these various schools and philosophical schools, it's like therapy, all these various schools of therapeutic approaches. I suppose ultimately one has to develop one's own personal philosophy.
Indeed, and I think so too. Now, that of course is a bit of a struggle because it's important, but everybody has to navigate our lives on our own ultimately. We come into the world alone, and we pass alone, and we
Yes.
journey alone. So we have to find, you, me, everybody has to find their own philosophy. Maybe that's why we search, and that's why I search, and maybe that's why you search, because we look and we read and we try and find the pathways that suit us. You will now
Yeah.
also, though, recall that in my article I said, even if we now find a philosophy like maybe the Stoics or the Humanists or whatever, is that enough? Is one philosophy the answer to a life as complicated and complex as modern living is? Do we have to not adapt and change as circumstances change, and maybe be a little bit adept at moving between different ideas and different thoughts in a sensible way, in a deeper way? Um, but
Well, I think you're
not
talking about
without
two.
a lot of them.
You're talking about two critical issues here, adaptability and flexibility. And I think that as much as one might be aware of different approaches or ways of being, it's a question of matching for situations. This approach maybe works better here. That approach maybe works better there. So that's that ability to flexibly adapt based on the circumstances. But that requires thinking
Yes,
at
and
the end of the day.
coming back to where we started, it requires pausing. It requires
Yes.
just holding the uncertainty for a while, occasionally just for maybe a second or two, but occasionally also for days or weeks on end, just holding that uncertainty, pausing, breathing, reflecting, and thinking, because deontology will not be the answer to everything. Utilitarianism will not be the answer to every case scenario. One does have to be knowledgeable and flexible between various approaches.
Yes. So that brings me to the contemporary approach. And in your article, you seem very enamored, and not for bad reason, because looking at what Professor Russo Netzer is about, I found it very interesting. And the issue of the existential reset, I'd never come across that phrase. So if you could elaborate a little bit on that without putting you on the spot to give a dissertation, just in a sense, that existential reset, what is that all about?
Yeah, this was very interesting when I read about this for the first time, Chris. In essence, what she says is that when we are uncertain and when we are struggling and when we are worrying and fearful, we should embrace it. We should embrace that uncertainty and fear, but not just embrace it, but we should do so actively. So it must become an active process of engaging with the uncertainty, not just waiting for it to pass, but to actively engage it. And if we do so, if that engagement, if we embrace that uncertainty in a particular manner, and I'll elaborate on that now, then suddenly there's a bit of magic that happens. And that magic is where we become more authentic. That is where we have that existential reset. That is where we start understanding ourselves much better, where we get new insights. And the way to do this magic is to be open and bring your own values into the decision-making process, to bring these deeper good virtues into the scenario, into the setting, and then make your decision actively, where you then hopefully occasionally will get deeper insight into who you are and where you fit into the world around us. Now, that
And
might
where
have
you
been
want to be?
a bit of
No, no,
a
no.
superficial explanation. She writes it much better, and it reads very well when she writes it.
Well, I think that what I took from what you'd said was that ultimately it repositions us, where we think to ourselves, should I be here? Maybe I should be there. But to be there is kind of uncomfortable. But if I really think about where I am and what's working and what is not working for me, maybe I do need change. And I think that is the existential reset, change of job, rebuilding, or getting out of a relationship, changing circumstances. So I think that is the existential reset based on who we really are. But it requires honesty. and a level of self-analysis where you really look at yourself. And I think that is not always easy because it's not always comfortable. But I think that's what I've understood about the consequence of what an existential reset actually means is you land up somewhere else, or you stay where you are, but with a clearer understanding of why I'm here.
Yes, and it's a process that happens, but it's a process that can be driven by ourselves. It's a process that you or me or somebody else is in charge of. It's a cognitive decision-making process of engaging with the uncertainty actively, with openness, uh, and then adding to that mix some deeper values, and then you find who you are. Then you can reset yourself. Then then you become a new person, and you have new insights, and you become even more authentic within the bigger world.
So again, this is how you use uncertainty to your advantage and
Yes.
betterment,
Yes.
actually. And I
Yes.
think that, again, we come back to the issue of reframing. And I think if we can see it that way, it's not threatening. It's kind of like, oh, this is opportunity for something different. And I think that's where we get to, this is another one that got my attention, because this is a very interesting phrase, the behavioral stretch intervention.
Yes, and I'm pleased you mentioned that because I did want to say it on this podcast. What Professor Rusinetsa has done is she's not just stopped where you and I are now. She's
Yeah.
actually now thought this through a bit more, and she decided to actually do an experiment where she asks individuals to not just deal with uncertainty, but actually to create uncertainty and fear and worry.
Aha.
So
Okay.
she's asked them to stretch themselves into uncomfortable scenarios, into scenarios where they are maybe less comfortable, more uncertain, but knowingly and consciously do that. So basically challenge themselves and stretch themselves into these discomforting scenarios. And what she then found again is similar, that when you actively do that, when you actually step into the uncomfortable space, actively, knowingly, consciously, then the magic happens.
I think you mentioned something very important. We choose discomfort in service of values. So once again, it comes back to what are our values and what does this situation evoke in us in terms of thinking really deeply about what our values are, actually, because values comes into it.
Yeah, and those are those fundamental human values that I think we all have, and that connect us at a very deeper global level, global humanity. We all have those deeper priorities, wishes, wants, desires, values, characteristics that make us who we are as humans. And if we could bring those values forward, and if we could connect at that value level, well, then I think the world will be a very different place.
Can't argue with that. So it kind of evokes, in matric, my set work was Hamlet. I didn't fully appreciate Hamlet, although there's so much wisdom that comes out of Hamlet. And the one that came to mind was Polonius giving advice to his son Laertes, where he said, to thine own self be true. And I think that's to some extent what we're talking about here, where you really kind of look at yourself and find out, well, who am I? And be true to that.
And now that you say that, I'm going to bring in the humanists because
Yes,
and the
okay.
existentialists, because they ultimately believe that to have a meaningful life, you need to be living an authentic life. You need to be authentic to who you are. You need to be authentic to your value system. You need to live the way that you would. You mustn't be part of a crowd. You mustn't be a follower. You mustn't be a tool in a toolbox or in somebody else's toolbox. You must rather live your life according to who you are and what is important to you. Never mind the rest, of course, within reason and all things being equal and fair. But living an authentic life ultimately will add meaning and happiness.
Well, just going back to Polonius, who he ultimately fell by the sword because he was a somewhat devious character, but he was capable of giving good advice, even if it didn't relate to him personally. So sometimes you can take good advice from a person who's not necessarily a good person. You take what they give. So I think that as we're coming to the end of our conversation, which has really been most illuminating and stimulating, and I've really enjoyed it. I think one of the take-home messages I get is that it's not about finding certainty. It's about managing uncertainty. How would you respond to that?
Yes, because that is part of life. Life is uncertainty. Life is uncertain. And to find meaning and happiness in that, we'll have to, as a first step at least, be able to accept and manage uncertainty, and then add in your values, add in meaning, and then make your decisions accordingly. And then you'll
Well,
find a successful, purposeful life.
and I suppose it's about engaging directly and in a meaningful way. And I suppose that's really the ultimate take-home message: is that you embrace uncertainty, and there are ways of doing that. Not least of all, I came across a term, puttering. I don't know if you've ever heard of puttering, but I would often see people say, "What are you doing?" I say, "Well, I'm puttering around." What do you mean? "Well, I'm doing this and that." Actually, it's got a scientific basis for being positive for mental health. Just doing a little bit of housework, working with the plants, puttering. So I think that's another approach for managing uncertainty. Do a little bit of puttering. It gives you a bit of distance, a bit of time away, and a sense of accomplishment in the minor, almost banal tasks that comprise our lives, but are very necessary. So on that note of puttering, I want to thank you, Volker, for making the time and just giving of yourself to engage with me and be part of this podcast, and for all of your wonderful articles that you have contributed and hopefully will continue to contribute in the future to South African psychiatry.
Well, thank you, Chris. It's been lovely having this conversation, and I appreciate your time and your invite. Thank you very much.
Fantastic. My pleasure. Thank you for joining me for this episode of Talking Psychiatry. I hope you enjoyed the conversation. Please feel free to comment and subscribe, and I look forward to seeing you next time. And until then, take care.